So after a rapid trauma survey, we've indicated that she has a left femur fracture. So our treatment method for today, we're going to be using the Sager splint, and it's going to be applying traction onto the femur, and it's going to alleviate some of the pain, okay? So before we do that, I'm going to check CMS. If my partner, if you don't mind, we can start setting up the Sager. The Sager is going to go in between your legs, and it's going to kind of shift over to the left side, just into the crevice of your pelvis. It's going to feel a little bit uncomfortable, so if you need to adjust anything, please do, okay?
Okay.
While she's doing that, can you feel me touching your toes here?
Yes.
Perfect. Which toe am I touching?
The big one.
Good. And which toe am I touching now?
The pinky.
Awesome. I'm going to check for a pedal pulse here. And I've got a strong pedal pulse as well. And can you wiggle out your toes for me? Good. Alrighty. So now we're going to be applying it on, okay? So if you don't mind, I'm just going to hold the ankle here. If you don't mind supporting the leg, we're going to lift your leg and put it onto the strap here, okay? Count of 3. 1, 2, 3. Good. Okay. So we're going to be applying that now. How does the strap feel on your ankle? Good?
Great. Yeah.
So yeah. Shift this up into the hip, just so that it's off, okay? And then tighten that. And that's comfortable up in there?
Sure.
All right, so Jenna, how much do you weigh approximately?
120 pounds.
Okay, so we're going to be applying 12 onto the traction. My partner, if you don't mind coming on the other side here and just kind of supporting the leg, I'm going to pull into the traction, and then from there we'll carry on with the process, okay? All right, so Jenna, I'm going to be applying the traction now, okay? You're going to kind of feel a little bit of the alleviation of the pain. If at any point it's uncomfortable for you, please let me know and we'll stop, okay?
Okay.
All right, so I'm going to start pulling now, okay? Okay, and that's at 12. Perfect. And can you still feel me touching your toes here?
Mm-hmm.
Show my touching.
The big one.
And can you wiggle your toes for me? Good. And again, she's still got a strong pedal pulse there. Okay, so Jenna, now what we're going to be doing is we're going to be applying the straps. These straps are going to keep your legs together, and then we'll transport you to the hospital, okay?
Okay.
All right, so let's start with the big strap first. So let's bring her legs in. So I'm going to bring this leg in, okay? And we'll bring it up just above here. Okay. Sorry, John. There you go. Good. And then we'll do that one. And let's bring it just above the knees there. Bring it over. Good. And the last one will be the ankles. I'm gonna check CMS just one more time here.
Thank you.
Still feel my feel me touching your toes here?
Yep.
Okay, good. Now which toe am I touching?
The big one.
Awesome. And again, we've got a strong pedal pulse. And we'll be transporting to the nearest hospital, which is Lake Ridge. Agreed?
Yes.
Perfect. So Jenna, what we're going to be doing is we're going to apply a C-collar first, just to immobilize your head, and then after we're going to be using something called a KED, which is going to kind of immobilize your entire torso. That's going to prevent less movement, because what we're suspecting is that there's some sort of spinal injury. So with the KED, that's just going to kind of minimize that movement, which is going to prevent further injury. Okay.
Okay.
So measuring up. Okay, she is no neck, so we are going to be applying this. Okay, pull, bringing this around. Is that comfortable for you?
Mm-hmm.
Good. Can you take a nice big swallow for me? Any difficulties with that?
No.
Okay, let me check carotid pulse as well. And I do feel a nice strong carotid pulse. Okay. So what we're gonna be doing is we're gonna be applying the head here, okay? This is gonna slide behind your back and then we're gonna strap it in, okay? So this is just gonna come up from behind you. Okay, so just try to move forward a little bit. Okay. And I'm just gonna grab the leg straps at the bottom here. Side. Okay, I've got this side crossed here. Perfect. All right. So we're lift your arms up a little bit. Bring this around. Okay. So we're gonna start with the middle strap. Okay. Just lightly tighten it. Okay. Okay, now we're gonna do your legs. Okay, it's gonna feel a little tight, okay? Okay, now we're gonna do your head. Okay, so this might feel a little uncomfortable, but it's going to help, okay? So we're gonna do your head first, okay? And now your chin, okay? And then the top, okay? And now we're gonna be tightening all the straps, okay? Now legs are gonna feel really tight.
Okay. Okay.
Okay, and the head is still good, and now we're just gonna do the top here. Okay. So now we're going to be lifting you onto the stretcher, and then we're gonna be transporting you to the hospital, okay? All right. So we're going to be placing in a King LT. Before you do, you want to make sure that there is no inability of the airway to be cleared. You want to make sure that there's no active vomiting as well, as those are contraindications as for the patient. The patient has to be in VSA in order for you to actually place the King LT in. You want to make sure there's no caustic indigestion as well as stridor, and you don't want any sort of airway edema. So we're going to be placing the King LT. You're going to need your specific King LT that is adequate for the patient. So we're going to be using the number 4 here. You're going to need some lube as well as a 16 milliliter syringe. So before we do anything, you want to pull back the syringe. And you want to test the King LT to make sure that there's no leaks in the King LT, which would cause any sort of leakage. So you're going to listen, you're going to feel and make sure that it keeps the inflation. Once you know that that is proper, deflate it. And while this is happening, your partner is still continuing with the ventilations as well. Okay, so taking your loop, you're going to loop the tip of the King LT. And also loop it a little bit at the top. You don't have to add too much just because when you insert the King LT, the loop is going to transpire onto the upper part there. So what you're gonna do is you're gonna have your patient ready. You're gonna come in from the side and you're gonna insert going down. Once you have the red piece kind of hit the top of the lip here, you're going to take your syringe and you're gonna add 60 milliliters of air into the King LT. And if you feel as though you need to add a little bit more air into it, you can add another 10 milliliters as well. So I'm gonna be adding an extra 10 milliliters of air into it just to make sure that inflation is adequate. Now taking your BVM, what you're going to do is you're gonna attach it. You're gonna use your filter and then attach it to the red part of the King LT. You're gonna give a first breath to see if there's resistance. So I feel resistance on the bag. I'm gonna pull up a little bit and try it again. As you can see that there's no resistance on the bag and I have good air entry because I can see the chest rise and fall. Just to make sure that your placement is adequate, you're gonna auscultate. What you're looking for is any sort of rise in the belly, which would cause some sort of like airway distension. That's when you know you've gone too far. So you're looking for that. You're gonna take your stethoscope, and while this is happening, your partner here can be continue with the ventilations. So you're gonna start at the belly, making sure that there's no air entering the belly. Coming up to the chest. So I hear a good air entry bilaterally from apex to base, so I know that the air is going in properly. The next thing you're gonna do is you're going to take the strap here that's going to keep the King LT into place. You're gonna insert that in, slide the strap underneath the base of the head, strap it in from the side here, and tighten it up. There's a little bit of a twist here. What you're gonna do is you're gonna twist it. Don't twist it too much, otherwise it's going to cause some sort of airway blockage in the King LT. You're also gonna mark where the King LT sits. So as I'm looking in the mouth, the edge of the mouth is hitting at the 16 centimeter mark. I'm gonna keep that in mind as a landmarking, so when you're transporting, if for whatever reason you see a change in that, you know where the proper placement of the King LT is. With your BVM, attach your end-tidal CO2 to monitor it, and you're good to go. So we're going to be applying CPAP onto this patient. We did our thorough assessment and we found that this patient is suffering from COPD. We heard crackles within the lungs, so our method for today, we're going to be using our CPAP. The contraindications for the CPAP includes asthma exacerbation, suspected pneumothorax, any sort of head or torso burns, tracheostomy, as well as the inability to maintain their airway, inability to cooperate, and inability to sit up. So right now we have our patient that's sitting up and cooperating with us. So we're going to explain to the patient that we're going to be using CPAP today. It's a mask that sits on your face and gives continuous pressure. And what that is going to open up the lungs, and it's going to open up the bronchioles, and it's going to help you breathe a little bit better. The proper application for this, you're going to have the face mask. You're going to have the part where it actually transpires the continuous pressure, as well as the filter, and also your end tidal. So what you're going to do is you're going to take the mask, you're going to attach it to the filter. Next, you're going to have your end tidal attached, and then this part will go into the filter here. So what you're going to do is you're going to also attach it to your oxygen. And our initial setting that we're going to do is we're going to start it at 5 centimeters of water. And we're going to start that at a flow rate of 15. So what you're gonna do is you're going to allow the patient to kind of hold the mask up to their face to be comfortable with it. This is going to allow any sort of anxieties and stress that comes with the CPAP. Just because of the continuous pressure, a lot of patients actually find a hard time dealing with it just because it's so unnatural as opposed to a nasal cannula where it's a low concentration. This one causes a lot more pressure, and we want to allow the patient to kind of adapt to the depth and the pressure of the air. So once the patient becomes comfortable with it, you're going to attach the head strap. This is going to go behind the patient and it's going to keep the mask on. So what we're going to do is we're going to take the straps and attach them to the green parts of the face mask. There's holes on the head strap that actually allow the head strap to clip right in. You want to make sure that the straps here have a little bit of some sort of like rigidity, just so that it is nice and tight and there's a constant seal. If there's no constant seal with the CPAP, a lot of the times that air is going to be leaking out of the mask, so having it nice and strapped in tight is going to prevent that. And you're gonna monitor the patient, and then you're gonna, if it's not getting any better, you're gonna auscultate, and you're gonna see whether or not you want to increase the amount of water and the flow rate, and just keep a constant maintenance of the patient.